Hi, my name is Pip. I'm one of the physios at Sydney Advanced Physiotherapy. I get asked about abdominal binders a lot for postnatal women, so I thought I would make a quick video on them. There are loads and loads of different types of abdominal binders, and this is one of the brands that we use. We have a couple that we use, but this is just the one that I brought home out of the cupboard. So the reason we like these ones is because they provide the compression required and they're comfortable. Comfort is really important when you're going to be wearing this a little bit, especially early on when your body is going to be experiencing a lot of new sensations and you're going to be busy caring for an infant. But these ones are actually quite comfy to wear. The idea with the abdominal binder is that it helps narrow the separation gap that's there in your six-pack muscles after you've delivered your child. It can also help in terms of fluid retention and helping that move through your system a little bit faster. They also help to reorganize your stomach muscle activation patterns to some degree, which is great because you're going to need your core system to be working well in order to prevent back and pelvic issues, especially while you're looking after a young infant who is going to get heavier and heavier. The best course of action to get your abdominal separation to heal is to actually see a women's health therapist or a physiotherapist who knows what they're doing when it comes to postnatal recovery, which is not every physio. It requires you to get a nice symmetrical core contraction throughout your entire stomach. And then from there, you need to actually load the collagen so it can thicken and heal properly so that your linear alba is actually functioning well to help you distribute loads, and that helps protect you from back and pelvic pain and other issues. But motherhood can be pretty overwhelming, so these braces can be a good place to start in the early days, particularly if you're feeling a little bit overwhelmed and like you're not quite ready for exercise and you're just a bit exhausted. This can be a great place to start in the early days, and you can grab these in the clinic or we can post one to you if you would like. You just have to call the clinic 94164410 to do that. When you're using these, the biggest window for opportunity to get change is in that first 12 to 16 weeks. Generally, I like to see people postnatally as early as possible because everything's still soft and supple, and we can encourage it to heal and tighten up in a better position the earlier we see you. And it also prevents your body from overloading and holding strategies and that becoming a new long-term posture or long-term tight spot for you. If we see you earlier, we can try and intervene with that earlier. But using an abdominal binder can be a great thing to do in those first couple of weeks if for some reason you can't get in to see the physio. Wearing an abdominal binder if you've had a cesarean is a little bit tricky. So in those early phases, you are not going to want a piece of elastic material down near the scar. That is obviously an infection risk and it's going to be pretty uncomfortable, and we don't want to do anything that would compromise the healing of that wound. So if you are going to try an abdominal binder and you've had a cesarean, you need to wait until that wound has well and truly healed. The advice in this video about abdominal binders is just general advice for the general population. We still really strongly advise postnatal women to go and see a women's health therapist. Your body has gone through such an extraordinary amount of change in such a short period of time, from conception all the way through delivery and then into the early phases of motherhood. There are things that you're going to need help with in order to have the best possible health that you could have and to minimize any issues that you might experience after having pregnancy and after delivering. So I really would advise you to seek the help of a women's health physio as soon as you possibly can. There are things we can start early in the postnatal period. Just really quickly, in terms of how early you should go to a women's health physiotherapist, I like to see people really early. There's lots of things we can do. In the early phases, you can get the abdominal system working and try and get the core system to come back. If someone has had a epidural, I like to check their nervous system and make sure that there's no restrictions within that, because there really can be after an epidural. And then once people have stopped bleeding postnatally, if they've had a vaginal delivery, usually around the 6-week mark, then that's when we start to have a look at what is your pelvic floor doing. Once again, we have these available in the clinic for you. If you need one, you can come in and grab one, or we can post one to you. You just need to call the clinic on 9416-4410. If you would like to book in to see one of our women's health therapists, you can book online via sydneyadvancedphysio.com.au, or you can call us on 9416-4410.